Good morning. Thank you for joining us for another in a series of Family First Health's community health briefings. Over the past many months, we've been reaching out to share information specific to COVID and related issues that are important to our patients. I'm Jenny Englerth, and I'm President and CEO of Family First Health. And at Family First Health, we focus on delivering primary care to vulnerable populations across our service area, which extends from Adams County to Lebanon County. And this morning, we're excited to revisit some of the information that has been important in the past, but actually more excited to talk about new information related to vaccine availability, something that is on our minds and a lot of conversation about across the nation. And we really want to localize that for you this morning. So I'm going to be joined by Dr. Matt Howie, Medical Director of York City Bureau of Health, for this conversation.
Hey, good morning.
Good morning. Welcome, Dr. Howie. Thanks for being with us. Thanks for spending a little bit of time this morning talking about vaccine in particular. But we're going to get started with just a little reflection and kind of level setting around where we are as far as COVID spread in the community right now. And I'm just going to put up, I think we've got a slide already up specific to Family First Health's experience. And this is a format that we've been sharing through these community health briefings over the last almost 10 months at this point. And so if we look back over the last 7 days, for Family First Health patients alone, we have a 21% positivity rate. So meaning that for all the patients we've tested, 21% are receiving positive results. That compares and is just a bit higher to our York County overall rate of 18%, and certainly higher than our overall Pennsylvania rate over the last 7 days, which has been 16.2%. My comment would be, though, in general, that as we've talked about these rates continue to be very high. We recognize that we are in a second wave of resurgence, and these results and impacts certainly demonstrate that. I'll also go to the next slide briefly. When we look at our overall patient population, we serve just over 25,000 people annually at Family First Health, providing primary medical care, dental care, behavioral health services. And we've certainly understood that the virus has disproportionately impacted many of our patients throughout the pandemic. To date, we've tested over 3,000 of our patients and are monitoring 528. That's our total number of patients throughout the pandemic that have tested positive. So we're working to support them at the time of receiving result, understanding how to mitigate impact, and then throughout the course of the virus, and then even in follow-up. We are monitoring many people who have some long-standing symptoms, and I think folks are hearing more and more about that as we move through this pandemic. And then the last slide that I'll share, and then I'll ask Dr. Howie to provide any comments from his perspective on the current state of the virus in our community. This gives you a look back from March moving forward of positivity rates over time. And although December isn't complete, really just want to illustrate that our November results and likely where we'll end in December are higher. We're having greater impact from COVID than we did in those early stages, April, May, when we look at rates of positivity. So that certainly tells us that we are in a time of significant community spread, and that all of the things that we've been hearing about for the last number of months as far as how we mitigate the spread of COVID-19 are really important. Dr. Howie, is there anything else that you'd like to say about community spread right now and just impact of the virus currently?
Sure. I mean, I don't think you can turn the news on and not recognize that there's a whole lot going on in this space. So to your point, we are in the midst of a surge right now. This surge actually predated Thanksgiving a little bit. We definitely saw some indications that the rates were going up, and that's likely weather related and time of year related, and there's other things that impact viruses that are there, but probably was augmented by those social gatherings that were there. very quick to say, however, I am not antisocial, I promise you. But when it comes to this context and this virus, it's making all of us pause when it comes to that in terms of times gathering together, just because it really does drive the spread. The mitigation efforts that are done when we wear masks and we distance really makes a difference. You can actually see that statistically when you're tracking those kind of metrics. They're hard things to do for this prolonged period of time, but they do make a difference. And we do know when that guard is let down, that makes a difference also the other way. And the schools have been a great kind of almost petri dish for us, where we've seen not a lot of intra-school spread, not a lot of spread within the schools, but that schools are reflecting the greater community. And when they're in social activities in the weekends and after school activities, we're definitely seeing the spread occurring in those spaces. And those are the cases that are being brought into the school environment. So it's a great kind of illustration of the fact that we do understand this and know this to be true, but how hard it is and how vigilant we have to be to make it work.
Yeah, there's a lot we can do to be part of the solution, but it's not easy work. And you're right, we have been at it a long time. And so today, it's exciting to talk about a more hopeful element of news that's emerging and our continued response evolving to COVID. So we're going to focus our time together on the vaccines that are emerging. One of my thoughts is that whenever we think about medical treatments and vaccines included in that, we always reference informed consent. We want people, our patients at Family First Health and all providers want their patients to really understand treatments that are going to be made available to them. And so in this point in the process, it's really important that people get the information that they need to make good decisions when the time comes for them to be able to have the opportunity to take the to take the vaccine. So as we think about that, we do have some anxieties and questions that people have, and we are talking about a fairly short time frame to bring these vaccines to market. And can you comment on the process, the steps in the process, and what we should think about this accelerated timeline, where we should have a level of confidence and where we might want to lean in and learn more for ourselves to understand the process that's been undertaken?
Sure. As a marketing non-person, as a non-marketing person, Project Warp Speed was probably not the best name to use for this. I understood what the intent was behind it, but it really didn't engender the kind of, it didn't address the issue that clearly, we have a very clear process when it comes to vaccine development. And you've heard things like phase 1, phase 2, and phase 3 trials. What we've seen is a pretty extraordinary thing where the actual trials themselves were completely done the way they should have been done. They actually overpowered the trials in terms of number of people involved in it. And the process in terms of analysis of these trials is as robust or more robust than any other vaccine development that has been done in recent memory. It's been an extraordinary process. What was done was anytime there was an administrative barrier or where things could be done in parallel, where you're working on two things at the same time, all those things were done. And we probably learned a whole lot about how to help work with administrative red tape and cut it out. It was the red tape that was cut. It wasn't the scientific process that was shortchanged. And that's a really important distinction. This particular vaccines, the early vaccines, are these things called mRNA vaccines, which are a relatively new technology and have been very, very helpful in terms of turning around vaccines in shorter periods of time because they're based on genetic sequences. So these are kind of like the daisy chains of genes, but it's a particular type of daisy chain of genes that we could sequence early. That means we could figure out what letter combinations were there and then customize a target on that particular gene when we identified it that allows us to then have a response to that particular genetic sequence. Not to get too wonky about it, but it's a really elegant way. It's been done before. It's been done with Ebola virus and actually been very effective in response to Ebola virus. They've actually stopped outbreaks in that particular area of Africa where Ebola was causing the issues that it was having, even subsequent to the big Ebola outbreak that we had concerns with prior. There was another one that occurred, and using the vaccine, they were able, using some techniques and approaches in public health, to get vaccine to the right locations, to the right individuals, and were able to help stop that. So the vaccine has been proven, even if the technology is pretty new. It's not the virus itself, and that's a really important distinction. This is not a live virus or a killed virus even. It's a section of genetic material that, by using that, tricks your body into saying there's an immune response to that genetic sequence, which happens to be those little crowns that go on the coronavirus. So the antibodies actually do go right after that coronavirus, and the effectiveness has been extraordinary. When you see 90+% effectiveness in a vaccine, those are the ones that make me go, really? Those are kind of eye poppers. HPV vaccine is the only one that's been close to this in terms of that kind of effectiveness. That's really good news for all of us. Now, what matters, however, on a larger scale, is we need to get enough people comfortable vaccinated, because that's what's actually going to stop this transmission more broadly in the community. It's great to protect individuals, but when it comes to vaccines, we understand, and it's gotten a bad rap, but this term of herd immunity really does matter in terms of breaking the cycle of virus being able to be replicated in the community. So I want to be able to answer as many questions as we can, but this is a vaccine that very much looks to be a very safe vaccine. What we don't know about the vaccine is what happens after 6 months, 12 months, 18 months. We're going to be watching those. All that data is being collected. We have been very clearly directed from the state. Data collection is extraordinarily important, and documentation is extraordinarily important, because we want to know the answer to that question. But because of the timeline of development, we're not going to be able to have that answer and as early as we would like to have it. But we're going to be watching for it very carefully, and hopefully transparently reflecting that data back as it becomes available, because we want people not only to be informed at the beginning, but informed through the process, so they can gain confidence in the process.
So when we think about, you've talked about safety, you've talked about effectiveness. Those are two things that we certainly hear as being top of mind for our own staff, and certainly then our patients and community members that we care about. You gave us a little bit of background on how the vaccine is constructed and how it's meant to work for folks. So when I think about other questions that we've heard and surfaced for people, is which you in part addressed, the lack of our ability to have longevity in our studies, right? We can't say over 2 years these were the impacts for folks. But from your impression in looking at the data and the work that's been done to date by really thousands of scientists, right, who have been contributing to this process throughout the world, right? So this has really been a historic time. I love listening to the interviews with those working closely in this process, and you can feel their excitement about this work. This is really lifetime culminating work for many of those folks who do this kind of thing every day. How will we start to be able to understand that long-term? You talked about data being shared with the state. Can you talk more about when the vaccine is broadly administered? What are the things that we're going to be looking for? Let's start with immediately. So what should I be thinking about when I am able to get the vaccine? What are kind of the short-term things I might think about as far as side effects? And then what are those things that may be monitored over the long term?
Absolutely. So anyone who's received a vaccine knows it's a needle, and that's going to cause some pain. So local site redness and swelling is to be expected, as with any vaccine. Now, every vaccine has a little bit of a different wrinkle to it. Pneumovax vaccine tends to have a little bit more of a reactivity than some of the other vaccines that we have. And you get the flu shot, and everybody tells me, I got the flu shot and it gave me the flu. Well, those are symptoms that people often get because that's your immune system recognizing something that wasn't supposed to be there. And in that process, part of that response is going to involve maybe elevation in temperature. It's going to activate your immune system. There may be some body aches involved, or muscle aches, joint aches. And those are expected after the influenza vaccine. Anyone who's had influenza knows those are very minor compared to what a full-blown influenza infection is in a vulnerable individual. I remember in training, I I was like, well, how are you going to know the difference? How do you know what is influenza versus a cold? And then once you see the first full-blown case of influenza, you go like, I get it now. Like it's pretty clear. It's a night and day issue. So when people say they got the flu when they got the flu shot, I kind of smile and go, good news. Your immune system did what it was supposed to do. And you're going to have that similar response when it comes to this vaccine. There is going to be a little bit of muscle ache, probably associated with some joint ache, and a little bit of kind of just fatigue that goes with it. It seems to happen in about 10% of individuals who get this first round of types of vaccine. That means 1 in 10 people will have those symptoms. And they're going to last a day or two. That seems to be the thing. They're giving us a 72-hour window with guidance that we're getting. But most folks are saying it's a 1 or 2 day kind of phenomenon. The other thing to keep in mind is this is a 2-shot series, the way that this shot works. The second shot in the series tends to have a few more symptoms than the first does. Go back to my previous conversation. That just means your immune system remembers what it saw before, and now it's having a more robust response. That is not necessarily a bad thing in the long term. It stinks in the short term, but in the long term, it actually is a really good thing. So you should be thinking about, like, if I get the vaccine, am I going to work the next day? We're having to actually plan for that as we're vaccinating healthcare workers, because we really need to watch that carefully, because some people may feel sufficiently poor enough that they really are going to be unable to continue work for that next day or two until their body kind of recovers from that vaccine. So those are kind of your short-term things. There's also been talk about some other things that we're watching carefully. There have been a couple of cases of Bell's palsy, which is where a nerve in the face actually stops working properly, and you get a little bit of droop on the side of the face. Now, that occurs already in natural population for a number of things. It can happen with trauma. Certain types of infections can trigger that. And so we don't know if this is background Bell's palsy that is occurring in the population versus specific related to the vaccine. And we're watching that carefully. It's certainly not a widespread issue. The other issue that has occurred when England did this, there were a couple of cases of folks with pretty significant allergic reactions that occurred afterwards. These were individuals who already had an established history of severe allergic reactions. Each of the 2 individuals initially identified actually carried EpiPens because they had had significant reactions in the past. So good news for them, they were able to address the issue very timely because they were prepared and understood that type of reaction. But we've had to put some cautions in there saying if you have a history of severe allergic reactions, please talk to us about it. If those allergies are related to parts of the vaccine, and the vaccine is not terribly complex in terms of vaccine components go, but if you have an allergy to those components, you shouldn't get the vaccine, clearly. If you have a history of severe allergic reactions, not specific to this, but just your body when it has those reactions, you carry an EpiPen because it's been a severe reaction, have a conversation with your provider about it. You can have the vaccine in certain circumstances, but we're going to watch you more carefully and for a little bit of a longer time period following just to make sure there's no problems there. But that needs to be a conversation with your provider that you have.
You made me remember something that we're talking about in our office that's going to feel a little bit different to people than maybe their flu shot, but may be more similar to folks who receive allergy shots, which is that observation period after receiving the vaccination. And like I said, for many of us, we're not used to that. We've taken our children to be vaccinated, and we don't need to wait that 15 or 20 minutes that's being recommended with this vaccine. So is that correct, that that's going to be a little bit different process than we might be used to with other vaccines? And again, just to overlay likely another kind of safety precautionary component so that we ensure that people are as safe as possible when receiving the vaccine.
Yeah, I think this falls into the abundance of caution category, which I think is a really wise thing to do when it comes to this. In my clinical background, I used to take care of a fair number of teenagers, and we started vaccinating teenagers when they got taller and their body wasn't sure how to handle blood pressure. And what we learned was a lot of those guys didn't do very well when they got needles. They hadn't had it since they were 5 or 8 years old, and then suddenly you give a vaccine to a 14-year-old, and you have these events where they pass out, the vasovagal events. And they went, "Oh, it's the dangerous vaccine," and I'm like, "Man, actually, it was the body's reaction to the pesky needle that actually kind of triggered the response." And I think that you need to be careful anytime you're putting a needle into someone who's not used to it. There can be a response that's physiologic. It's related to how the body responds to this. That can be significant. And the last thing we want is people saying, "Oh my goodness, this vaccine is leading people to pass out and it has some long-term issue." The vaccine, again, we're going to learn more about the long-term issue, but in that short term, 15 minutes. Let's make sure nobody has a reaction that we need to respond to keep them as safe as possible. Very reasonable. The challenge with that is actually trying to coordinate that with large-scale vaccination. I think in a doctor's office, a provider's office, it's a lot easier because you can say, hey, hang out in the office here. We'll come in and check on you. Have a seat. Oh, life is good. But I think if you're doing large-scale operations with rolling people through getting vaccine in a we call them point of distribution or a pod operation, that kind of piece of 15 minutes on the tail end of it is a real operational challenge. And we're working through some of those challenges.
Sure. Lots of logistics to work through. I'm certain of that. When we think about the populations that you and I care a lot about, so I think about particularly the work and areas where we overlap and work for York City. When I think about the broader community and for Family First Health communities that we serve across 4 counties, many of our patients, as you saw in the earlier data, have been greatly impacted by COVID already due to the work that they do, the situations that they live in, have made mitigation more difficult. So, and we also understand that there are historic challenges and perceptions and realities that may negatively impact particularly Black and Brown communities' perceptions and attitudes around receiving this particular vaccine. I know that it's something that we within Family First Health have a desire to kind of address head on, and this conversation as well as others will be an important part of that learning process. We're probably all aware at a community level that we're starting the vaccination process with healthcare workers, particularly those working most closely with patients with COVID. But quickly, we're going to be able to share this vaccine or the vaccines with the broader population. And so can you speak to your thoughts about some of those historic incidents and how they may impact people's perceptions and actions now, and maybe information that those individuals who are anxious about this and questioning, what are the things that are top of mind for you that you would like them to understand or to learn more about?
Wow, I mean, this is one of those subjects, and as you alluded to, we've talked about this in other contexts many times. When it comes to trust in the healthcare system, trust is earned, and people have long memories and appropriately long memories when it comes to this. I've worked in underserved health prior to my work in public health, and that's always been a challenge for me. I mean, I'm a white male. I come from a different lens and a different experience, and I had to humbly acknowledge that's not everyone else's experience. And it's not just because I have a really good idea that somebody else is going to say that's a good idea for me as well. I think when it comes to this, it's going to be one of those things who are the trusted sources of information? Where are the places that you listen or you go to when you have questions? I would encourage this to be a conversation that's a candid conversation in a medical office if need be, by telemedicine, whatever that venue is, just to get those questions answered by somebody where the person that you're engaging with, you trust those pieces of information. We're going to be doing advertisement. We're going to be doing a lot of these kind of promotions, and I think those are important pieces to get to the broader community. But I do really worry about populations that are, as you outlined, disproportionately affected. We're seeing more cases in this. Your work when it comes to Family First Health, it targets this population, and it shows in terms of the positivity rate in terms of your tests. It illustrates it very clearly. You have a high-risk population, so you guys, folks who work in vulnerable populations and safety net practices, are going to be a critical piece of this, to be able to get that message to our contacts in the community where you develop that trust relationship over years or decades. So that conversation can be candid. That conversation can be brave enough to address those issues head on, like you said, because there's no other way through this except directly through that, having those conversations that are tough conversations, or else we're going to continue to see lives lost that shouldn't be lost. Every one of them matters to us in our work. I want everyone to get the vaccine who can get the vaccine, because I care about the well-being and safety of those individuals, and that message needs to be communicated forward. This isn't a grand experiment, but I tell you, it's uncharted territory. When it's uncharted territory, you got to look out for each other, and you got to have those folks that you trust as you go through those spaces.
Yeah, and I think to borrow your term, we've been in uncharted territory since March, right? So there is a weight that we're all carrying around life in this pandemic. But I hope that we can close our conversation or approach closing our conversation with also understanding the hopefulness that we're starting 2021 with, that was difficult to imagine in April of 2020, that we would be at this point. One thing that I want to say is that we don't know when exactly the vaccine will be made available to the general community. But I know that Dr. Howie, I know that all the folks at Family First Health and many, many others are working diligently to make the community availability a top priority. So we would expect in the coming months that if not much sooner, that the vaccine will be available in the community. And in the meantime, this is the time for people to learn and for people to ask their questions and to get all the information they have. On the Family First Health website, we have added a page with references, videos, printed information in English and Spanish as just a holding place. And we'll keep adding and updating that information as a place that people can go, as well as continuing to have conversations like this. We have received a question, and if there are any other questions, please feel free to put them in the chat. And this question is a great one because I think it starts to get into the weeds of the logistics about kind of what this might mean to me. If I'm able to get, when I'm able to get the vaccine, and maybe the folks that I'm living with or interacting with have not at some point, and I become exposed to the virus, does that protect me? Should I still be worried about transmission to other people? How does that work for folks? How should we understand that?
Really good question. This is one of those areas where the vaccine is not 100%. So if I give somebody a 2-shot series, do everything by the book, the Pfizer vaccine looks to be 95% effective in that setting. So who is that 5%? Can I pick the 1 in 20? Who's going to be the person who doesn't have that response? The answer is I don't know. You can do antibody tests all day long. It doesn't mean that you're necessarily protected because antibody tests are an imperfect science, and we use that as part of the broader clinical picture. There's no one test that kind of helps us through this perfectly. So you could be one of those, that 1 in 20 that is not protected. And that's why when we're vaccinating, we're saying still wear the masks, still do the distancing. We got to get an adequate amount of vaccine to really have the impact we're looking for. I think you're really looking at symptoms at that point. So we're going to be going back to that old song that we went to before, which is you've been exposed to COVID. All right, let's talk about how you're feeling. Are you having symptoms or not having symptoms? Let's talk about what quarantine looks like versus isolation if you have active disease. We know that the symptoms are variable. We have had people who've gotten COVID twice. It's a rare event, but it does occur. And because it does occur, we need to have a conversation about what that means. We used to say, okay, the second one won't be as severe. There have been a couple of cases of second infections that were a little more severe than the first one. And we're not 100% sure why that looks that way. It does not seem to be very common. It's a very rare event. When it happens, it does happen. We'll know a lot more after we have vaccinated people who were exposed, and then we'll kind of see what that looks like, because that's going to be a little different context. But we're going to be going to a very similar pattern before, quarantine. Now, we have had some changes on quarantine recommendations. Depending on your situation, quarantine can be 14 days. That's the historical norm we've talked about, and that's the limited contact and all the things that we asked to do, not going out into public, except in certain circumstances. We've now been able to reduce it to 10, it looks like. But this is all a continuum. If you make it 10, you're increasing the risk of spread a little bit for folks who ultimately develop that infection. But it seems to be a reasonable trade-off at this point. But I think that's going to be the answer to that kind of question. You got the vaccine and you're exposed. For now, we're going to treat you like you're exposed. We're not going to create a second subcategory for you at this point.
So I think what my takeaways are from our conversation is that we enter 2021 with new tools in our toolbox as it has to do with COVID, as we think about vaccines, as we think about our understanding of mitigation efforts, the data that's emerging behind mask wearing and social distancing, really telling us that those things work, that we can be part of the solution when we engage in those areas and change and alter our behaviors. And so as we look forward to the vaccine in 2021, we also should recommit to those preventative behaviors and mitigation behaviors that will allow us to protect ourselves and others as we move through likely a year of getting the vaccine to be more available to people and continuing to learn and understand. So I really appreciate your time this morning and sharing your expertise. I hope that we have opportunity to continue the conversation. I think there'll be a lot more to talk about as we move through the coming months. And really encourage everyone to learn what they need to learn to become comfortable with and to get their questions answered in regards to the vaccine, so they are prepared to make the right choice for them and their families when the opportunity becomes available to them. Dr. Howie, any last words from you?
No, I mean, if 2020 is the year of COVID, I'm going to say that 2021 is the year of COVID vaccine. And we really need to, that's our way through this. This is our path through this challenge. Anybody who is disrupted by this infection and the pandemic should be really carefully taking a look at the vaccine, because that's what's going to allow us to move forward.
Absolutely. Thank you so much for your time. Thanks to everyone who participated this morning. Have a happy and healthy 2021 and learn all you can about the COVID vaccine. Take care, Dr. Howie.
Take care. Thanks, Jenny.